Good afternoon, everyone, and welcome to this webinar of the JoinHealth Spring Series on Innovation Procurement in Health. So these webinars are a collaborative initiative of the Health Cluster Portugal and the EIT Health. And today we have Miguel Amador and Vera Moura from the EIT Health. And the aim of these webinars is to bring awareness over some topics of interest in health and to promote knowledge and networking. So in today's webinar, we'll have two different, I would say, but complementary perspectives over this topic of innovation procurement. We will start with a presentation by Dr. Ricardo Bastos from POOF Hospitals, who will present a view of innovation as a procurement strategy in private hospitals. And after that presentation, we'll have Dr. Alexandre Lourenço, hospital administrator at University and Hospital Center of Coimbra, who will bring us a perspective and his experience on public procurement as an innovation instrument. So thank you so much, both of you, for being here today with us and for accepting this invitation. Just to give a brief note for the participants that after each presentation, we'll have time for discussion and questions from the audience. So if you have questions, just drop them in the Q&A box and we'll ask them to the speakers. And as usual, the presentation slides and the recording of this session will be available after the webinar by email upon your request. And the recording will also be available in the Health Cluster Portugal's YouTube channel. So moving to the first speaker of this session, Dr. Ricardo Bastos is the head of procurement and supply chain at POOF. He has a degree in economics and an MBA. And during the last 5 years, he has worked in negotiation, purchasing, and logistics. So previously, he had also worked as a consultant in various sectors and different companies. So again, Dr. Ricardo Bastos, thank you so much for accepting this invitation. And I invite you to please start your presentation.
Hi, Patricia. Good afternoon, everyone. First of all, I'd like to thank this invite. It is I'm very proud to present this presentation, and I'll try to share with you some information, and I hope I'll be sufficiently clear on my explanation. Are you seeing my presentation?
Yes. Yeah.
Sorry. Okay. Are you seeing? Okay. Yes. So let's start. Well, POOF, presenting my company, POOF is the largest private healthcare provider in Portugal. We are spread out in several main cities in Portugal, and some numbers for context. We have more than 7,000 employees. We run more than 1,000 of beds, more than 1 million of clients, and more than 55,000 of surgeries per year. On a country like Portugal, these are significant numbers, and that's why we are the largest private healthcare provider in Portugal. POOF is a part of a major economical group, José de Mel Group, which has very different business, as you can see, from highways to industrial chemicals, our private hospitals and clinics, solutions for old people, wine production, maintenance services, engineering, and energy. And there are very different businesses on this major group, and is a very nice challenge to address our innovation to that different perspectives. Oh, well, sorry. Okay. Normally, when I talk about innovation, I always feel the need to clarify what innovation is for me. Okay, there are many definitions of innovation, but I need to clarify this idea on my mind, and I think this is a very nice picture, very basic picture that helps me to clarify this definition is a definition or a picture from a professor, Nathan Fuhr from ECR, that show us that there are a lot of inventions. With this technological boom, we have a lot of inventions in the marketplace, but not every invention is an innovation, and we need another angle to see what really is innovative for us. And when we intercept invention with the need, there's a space that we can name like innovation. And this is very important, because if you don't focus your analysis on the innovation, sometimes we feel lost in the middle of an ocean. And it's very important to focus and to know what innovation we are looking for. Okay. Well, POOFs innovation strategy assumes distinct approach according to the time impact. On a short term, we name the incremental innovation, and we are fostering an innovative culture on the company, on the different companies, by engaging our employees in innovation challenges and collect ideas and implement changes that increase our efficiency and help us to deliver a better service. When we look to a medium term, we are talking about planned innovation. And here we are creating new products, services, and partnerships. By partnering with startups, we test and incorporate innovative solutions in a fast and agile way, allowing us to remain technological up to date. Nowadays, my area, procurement, and my team, we are very focused on this phase. And in the long term, we are talking about exploring future trends. It's very important, but it's more futurist view. Well, in 2017, José de Mel, the major group, launched Grow. Grow is a program, an innovation program that accelerates startups' growth and fosters innovation inside the group. And this is very important, because we have like a parallel team helping all the companies in all the areas to foster their innovation and to create the innovation culture and the innovation processes you need to go on this path. So it's very easy to work on this with this team and these people, these colleagues, because they help us a lot to go on this path. Right? Well, POOF establishes strategic partnerships with players in the innovation ecosystem in order to ensure a fast incorporation of new and innovative business solutions and products. Okay, and how does the Grow program works? First of all, and this is very important, as I said before, you need to mapping the planned strategic and operational projects that you are looking for. As listing of internal challenges and yet to be addressed. This is the way that you focus. What innovation are you looking for? Avoiding to be lost in the middle of that ocean that I talked about. And then when you have your needs and the operational project you are looking for mapped, then you go in this process, okay? When first of all we validate the ideas or the ideas that we have internally or that comes from external from outside of the company, then you can pilot them. It's very important to pilot to know if to make some proof of concept, and then if they pass those two phases, accelerate in order to come the easiest in the fast way. This is how our Grow program works, and the lines that oriented this program, this innovation program. Well, here we can see a part of our startup landscape in Grow Health. Okay, the vertical program that comes from the healthcare to the healthcare. We have done more than when I talk the innovation team made more than 9,000 contacts. We have nowadays 9 closed partnerships, and I'm giving here a good example of this program. We have more than 20 equipments of blood tests locating on point of care on our hospitals. What is this? I think everybody knows that normally when you go to the hospital and need to do some blood test, the blood sample is we need to send it to the laboratory, and we need to wait a few days to know the results. But in some activities or some areas of the hospital, the emergency room, for example, you need to have those results on a faster way because you need to decide what to do with the patient. So we have a Portuguese startup named BioSurfit. He's here. That developed 4 or 5 years ago, 6 years ago, I can remember now, a new technology, a very interesting technology, where you can put the blood sample on a compact disc, a real compact disc, and then you put the compact disc on the device that runs some technology things that I cannot explain, and you have those results on a faster way. When we talked the first time, it was I think they had at that time only one result available, which was very poor for us. But we saw on that technology that was a very happy way to go with them, because they had at the time a very good roadmap with a lot of blood tests that interested us. So we have run this path with them 4 or 5 years from now, and nowadays they are implemented on our hospitals. Okay, now they are a reality. Okay, they have come up to our activity. So now thinking about procurement, leaders in the market have recognized that traditional procurement departments need to evolve to the innovation-driven procurement. Okay, you need to deal with a different perspective when we are talking about innovation. Of course, we don't buy innovation every hour and every time. But we need to know in what kind of products or what kind of services we are looking for or buying, that you need to put another perspective, another way to work, another way of work to do that procurement. And we call it that different perspective, the innovation-driven procurement. And we are attempting to delivering more innovations in less time, accelerating design and launch cycles, improving products and services price-quality ratio, and increasing the end customer's experience and satisfaction. Okay, that there are the main goals or the main objectives of this innovation-driven procurement. And normally, in the traditional role of procurement was to secure the availability of goods and services required to deliver care. Nowadays, healthcare institutions are looking for innovation through procurement. And this makes procurement to becoming a strategic role on a company. This is very important because in the past, the procurement was reactive to the company strategy. Nowadays, procurement, mostly by the innovation angle, is becoming a strategic role in a company. Okay, how does we do this innovation-driven procurement? There are 3 different stages or phases on the process. The first of all, the identification. Okay, is very important. As I said before, know what you need and define it in terms of outcomes, not solutions. Okay, when we talk with our innovation team, we don't define objective things. Okay, we are looking for different outcomes, different ways to respond some needs, because if you define the things the oldest way, you have the same outcome. Okay, then it's very important this phase, the way as you do the identification of your need. And the second part that fortunately POOF doesn't have that problem, but it's very important to tell the marketplace in ways that convince them that you are a credible customer. Okay, at POOF we don't have a lot of effort on this point, because it's a very known and very recognized brand in the marketplace. So most of the companies in Portugal want to be part of our ecosystem and work with POOF. But it's a very important phase if you are on a different position at the marketplace. And at the end, very important, the last but not the least, what we call pro-innovation in procurement is after having clearly identified the needs and after engaged the supply chain, the next step is to ensure that the tendering process is designed to support and enable innovative solutions to be presented and compete on equal terms. Okay, this is very important because it's very difficult to compare innovation or innovative products with other ones. Okay, and you need to adopt or adapt your procurement processes or your tendering processes in order to have the best comparison between several or different kinds of products and services. Okay, above all, this means adopting non-price based award criteria. Is very important. Evaluating offers on value. Okay, the value, that their total cost of ownership, and not simply the price, is very important, because everybody knows that the innovative products are obviously more expensive than the other one. So you need to compare them fairly. Okay, and the best way to make this fair analysis is to put your analysis on value, not only on price. It's very important to identify your innovation procurement driven maturity stage and to know what to do to improve it. Okay, we have followed these matrix in order to know what do we need to improve or to achieve in order to be a leading class in this area. Nowadays, I don't think we are leading class now yet. Sorry, I think we are in between advanced and leading class. Okay, because there are some difficulties we still have. As you know, the healthcare sector is a conservative one, and when we say that we need to test and need to pilot, most of the times we are talking about patients and diseases, and it's not that easy to accelerate those processes. Okay, but in fact we are looking forward to be leading class on this innovation procurement driven process, and be differently as a different presence in the marketplace. It's not easy because even the providers and the suppliers, most of all, are resistant to this kind of procurement. They all try to sell innovation. Most of the time, we see that they are trying to sell inventions for us, and it's very important that you can separate those different worlds and know exactly what we are buying, what we are tendering. If you are on the innovation environment, or you are only try to buy an innovation or an invention, a sexiest invention to show someone that you are very innovative. It's very important to clarify and to make the difference in these two kinds of procurement. even there, this is my presentation. I don't know if I have accomplished the schedule, but it's my experience, our experience from our point of view. Here is our contact for our innovation team at POOF. So you can talk with us and present products and ideas. We are very available to see what marketplace and other companies are doing, of course. And if I have 1 or 2 minutes, I would like to show you. I think the most innovative thing or most innovative equipment technology that we bought recently, 2 years ago, and it's very interesting to see that kind of technological innovation. But you can always look the innovation in other ways, because you can do some innovation in processes, you can do innovation in your team, in your organization, not only on technology. But I will show you a very good example of technology innovation. Is a surgical robot that we have on our hospitals. But if you can look forward from this video, you can see that in the future, you can do the same that we are doing now with our surgeons, but with a totally different way. In the past, you can have 5 surgeons on a room that they are operating very different hospitals away from that site or where they are. And this is very interesting. That it means that the technological innovation can go further than that and can bring other kind of innovations from the processes and the way we are organized as a company, etc. Okay, so I'll try to put this video in order to know our surgical robot named Da Vinci. It's about 2 minutes, and then I'm available, of course, to some Q&A. Thank you very much. I hope I try to be as clear as I want, but of course I will clarify any ideas if you want. Thank you very much. Well, are you seeing me?
Yes. Dr.
Okay.
Ricardo, thank you so much for your presentation. It was very clear. And we all got to know more about the hospital, which is one of the, well, the biggest hospital in the private sector here in Portugal. It's a delight to see you. And I would like to ask you some questions from the audience regarding the presentation. We have one question, actually two questions from the same person, and I think they interconnect. So could you explain how do you validate the startup in your three-step approach, and how do you work with that startup to pass the phase of validation?
Okay. So we have that grow team that are connecting all the time with our ecosystem of startups, and they are collecting as some innovations, ideas, and whatsoever that feeds our needs. Okay, and then we have a very normally we can help them to make some proofs of concept on our hospitals, on our clinics, in order to validate if their innovations or their technologies or whatsoever they are really good, and if it comes right to our needs and to our expected outcomes. Okay, if we confirm that situation, then you can then you pass to the real procurement process. Okay, you need to compare that solution, that product, with other similars that we have or that the market has, in order to know if on the value perspective, if they are competitive and they are really good solutions for our company. Okay, I don't know if I have asked your I have I don't know if it was clear, but normally who makes that all that process is that this grow team that help us. They are working with us, and they are they are enablers of this process. Okay, they can accelerate this kind of process.
So it's something internal to assess
Yes.
the needs of the hospital or
Yes.
of the group, and you provide this kind of validation, and if the technology proves what it was expected, what it was hypothesized in the beginning, then you continue with the whole steps until until you have a final product available to be used and administered, administered.
Yes, and
That's what happened with Biosurfit.
yes, and this my colleagues from the grow team they are very important because they can make that filter. It was very difficult to my team to our outlooking all the marketplace with all the solutions that are coming up, and then continuing doing their work, their procurement tenders and whatever. So this team makes that the first part of the process. Okay, making a filter and making the identification of solutions and products that will feed our needs or our outcomes, and then with us we can test them, pilot them in real world. And I think this is a huge advantage that we can provide to our ecosystem, that we can put them on the real world to test them and to give them two important things: or a go, that is the what they are expecting. We have a go to go to next phases, or some important inputs. Why those products or those solutions doesn't fit our needs. Okay, and I think they are both important contributes that we are giving to the startup ecosystem.
So the same person asks if those needs are collected among multiple hospital team, your team,
Yeah.
you already answered that. And it can be operational, clinical, whatever
Yes.
need it is.
Whatever need it is. Normally, we try to look or to implement or to prove the product or the service uh, in the best hospital, because all the hospitals are different. Okay, because with different characteristics, and we try to test it on the best environment to test. Okay, in order to facilitate and to help integrating those products.
So next question. There's a compliment on the presentation, and actually it's two questions. What are the main factors for taking so long to do a pilot in a hospital? And what role does procurement play in this process?
Okay. We are enablers. We are between the market and our physicians. Okay, we are in this space. Um, uh, Normally, when it takes too long, it's because, as I said, the healthcare is a conservative sector. Okay, our physicians, when you test on a person, on a patient, is not like testing cars or testing plants or testing other on other environments, and that's why normally it takes too long. And our physicians, they are conservative too. Normally, they are used to use some technology, some product, some medical device, and you are challenging him to change the way he is usual works. Okay, and from a patient perspective, and imagine that everyone somehow someday will be patient. You don't want to have a physician, a doctor, nervous. Yeah, you want to be with a doctor who is very comfortable with their technology and their machines and their devices. And so the physician, it takes so it takes too long to make these decisions, and only when we have some validation, some clinical validation, uh, only that moment we can give a green light to the market. Otherwise, we need to wait for those results. Okay.
Yes, it's not easy, and everything has to obey to regulatory process.
Yes. Yes.
And it's not up to you only. Unfortunately, you have
Yes.
all the medicines agencies, the clinical device, whatever it is that you need to obey. And it's not just interaction with the patient, with the physician. You also have to interact with the authorities, and
Yes.
bureaucracy also takes time. It's not easy, but
It's a very important point, because normally the innovation is one step ahead from the regulation, and it's not easy, because we need to be certified, and we need to have all our processes and the technologies and hospitals, whatever, certified. And we have faced some difficulties to have some validation from the regulatory entities to some innovative tool or innovative technology. And it's a very difficult. It's very difficult to go ahead if you don't have that kind of validation.
yes,
Okay,
and
it don't depend on me. Normally, the procurement team here in POOF, we are very close to our physicians. Okay, so we work as enablers, because we can make some push of testing and piloting the products. But from this point, from this stage, until you gave the green light and implement and across all our hospitals, it goes a long time.
yes, indeed. Um, Also, another question, and congratulations on your presentation. The question is, how can we articulate and connect the innovation procurement driven with the classic funding system? either from the Ministry of Health or subsystems?
It's a huge challenge. It's very difficult. It's very difficult because normally the traditional funding they looks backwards. Okay, they use some casuistic and some numbers, and they are how can I say they are on sitting on historical information. But the innovation with the innovation it comes things that we don't know yet, and we don't have all the information yet, and it's very difficult to them to give some more money for the unknown. Okay, and it's not easy to match those different realities. Okay, it's not easy. Normally, we have some innovations that at the beginning must be our clients, our patients that pays out of pocket now. Okay, normally it happens, and then we start the process again and try to convince the insurance and all the funders to pay this technology, to pay this innovation. But it's not an easy task. It's not that easy. It takes too long too. It's one more contribute to this process take too long. That's why it's very important these programs like ROW, because with our colleagues we start the process on earlier days. Okay, we try to gain some time at the beginning, because at the end we know that we are facing some difficulties, and it will took a long time, and we try to anticipate and to know all the solutions that feeds our needs at the earlier days. It's important to gain that time.
A very good strategy. Okay, so I think we have no more time for Q&As, and from the audience, these were the questions that were written. So Patricia, over to you.
Thank you, Vera. Thank you, Ricardo, for this very nice presentation. So there is another question from in the chat that actually I think it serves as a very nice segue for the next presentation, which is do you consider that if POOF was a public hospital, the approach to innovation procurement could be the same? And probably the answer is no, and I will leave that for our next speaker.
It's not necessarily no, okay, because we run 2 public hospitals till 1 month ago, and the process was exactly the same. Okay, and I think you will know, and Alexandre Lourenço will give us their vision, that we are complementary and we are doing the same. Totally. Okay, we are doing mostly the same.
Yeah, I think it's important to have these two, as I was saying in the beginning of this session, also complementary views. So just to finish, and I know that you'll have to leave the session before the end of it. I would, and because unfortunately there was no sound on the movie that you were sharing with us, I would ask you to please share the link in the chat so that the participants can actually access the video online.
I'm so sorry, I couldn't see anything, and I'm so sorry. But at the end of my presentation, the last slide, you can link to that video. Okay, perfect. It's a very nice video from our Da Vinci system.
And there also. Sorry. No problem. So there are also some questions and interest in the GROW program. So I think you have the email address to which people can send their doubts and questions. So if you want to have this presentation, so just fill in the questionnaire that we'll send you after the end of this session. But now, so thank you again, Ricardo.
Thank you very much.
moving to the next speaker of this afternoon, who will bring the topic of innovation procurement from this perspective of the public sector and how some of these obstacles or not can be overcome. So he's Dr. Alexandre Lourenço. He's the hospital administrator at Coimbra Hospital and University Center. He's the president of the Portuguese Association of Hospital Administrators, and he's on the board of the European Association of Hospital Managers and of the European Health Management Association. He has held public functions in several institutions of the Ministry of Health, and he's also a consultant of the World Health Organization in areas of financing and strengthening of health systems. He also coordinates the post-graduation in health institutions management at ISEG Lisbon, School of Economics and Management, and he's currently a doctoral candidate in management at the Nova School of Business and Economics. So, Dr. Alexandre Lourenço, thank you so much for accepting this invitation, and the screen is yours.
No, thank you, Patricia, for inviting me to be with you. It's also a pleasure to be at the same panel as Ricardo Bastos, and it's a pleasure, of course, to be with our IT Health colleagues, Vera and Miguel. So thank you so much. I don't know if Ricardo is pinned on the system, so I'm continuously seeing him. I don't know if you can unpin him.
Oh, yes.
Yeah, I believe it's okay now. So
sorry.
Thank you so much. No. Thank you so much. So mostly, as Ricardo was saying, there isn't so much differences between innovation management in public or private hospitals. Actually, we are talking about innovation management in healthcare. But what I'm going to show you is a strategy where mostly the European Commission try to promote since 3-4 years ago. That is public procurement for innovation. At some point, the idea is mostly to assure that most of the funding that we have in our public funding can be directed to innovation or towards innovation, and not to final products or solutions. So let me start to share my screen and to show you what I will be talking about. Mostly I will talk a little bit about health systems paradox, where are we now? And then I will talk about new needs, old problems, where innovation can play a role. And mostly I will talk about innovation procurement in two main areas. One is public procurement of innovative solutions. And I will show you a case study that we have here at Coimbra University Hospital, that is Procura. And I will show you another example of another project that we have, a pre-commercial procurement, and I will invite you actually to the open market consultation that we are going to held on the 30 June. And for the ones that are interested on this area, please join on that event. Let me just start to talk a little bit about the health systems. As you may know, health systems are quite connected with the development of monotheistic religions. And actually, they started mostly to, hospitals were developed or started to be developed mostly to provide care to the most humble, the poorest of the poor. And actually, most of the aristocrats and the bourgeoisie, actually they were treated at home. And we are only going to get to the new system where hospitals are a center of technology after the Second World War. And actually this system that we know at this point, that actually hospitals are mostly the new cathedrals, the center of technology, and the center of our common life, where we are born and when we are treated and where we die. It's developed this concept since the last 70 years. So it's a quite new concept. And actually at some point, this growing differentiation that we have seen and this incremental innovation that we have seen in the system actually it also gave us a lower integration, an increase of the fragmentation of services, and actually we are much further from what we wanted to develop, that is a more people-centered care, and mostly also in areas related to aging or with other social health needs. We see that the system is not delivering. So in that sense, and let me just show you what would be the stages of developing health service delivery, and what we aim at the end, and where innovation can play a role. Mostly, let me tell you that also the system is a very complex system. Even Peter Drucker was saying that hospitals are the most complex systems in all economic areas. And actually, we can say that mostly we started with the conventional care, where we continue to have vertical organizations. Management is mostly focused on production, and quality is measured on inputs. Most of our providers are still on this stage. From this stage, we evolved to a disease-oriented model of care, we are more focused on disease management, in linkage between providers. We increase the ability of managing resources, but we are mostly focused on the quality of the outputs. When I'm talking about outputs, I'm talking about the number of surgeries, the number of clinical or medical appointments. And actually this stage, we started to develop it during the 90s of the last century. Actually, from this, we evolved to coordinated services, where we have more focus on care management. We started to believe that the system needs to be more horizontal, that follows the patient pathway. And actually, we start to manage our performance, and we believe that we need also to focus on the quality of processes. Even though these coordinated services, again, they are not delivering, and they are not being really focused on the individual needs of patients. And there where it enters the integrated services, where we focus on the whole person needs, and where we have a collaborative system, social services, health services, private services, hospital, pharmacies, primary care centers, new ways of providing care, new providers that need to enter the market. And actually, we start to focus on the outcomes, on the real results that should be measured. And we focus also on the quality of those outcomes. Yet, the system continues to be quite verticalized. And most of the ways that we see the system, most of the ways that we work, we still see the system in different ways. And it's quite challenging to work in integrated fashion. And one of the issues, of course, is the resistance to innovation. There are several theories. I will not bother you with it, but the health system tends always to status quo. There are several reasons of it. Mostly the system that developed from the post-Second World War is a system that tends to status quo. Actually, even though we have incremental innovation and we have lots of innovation in different areas, the organizational model continues to be mostly the same. The way that we provide care, it stays the same, and we have difficulties to evolve on this system. It's quite difficult for innovative solutions enter the market. It's quite difficult for new providers, new professionals enter the market, and that's something that we need to deal with. What we also know is that the organizational forms that we have now, that they emerge followed by the functions, of course, actually they are continuously delivering the same level of services. So they don't allow the interest of new ways of providing care. So in some way, we need new organizations to provide different solutions. And that's where the European Commission enters, and this concept about innovation procurement. Mostly the idea from the European Commission was to use public budget, the budget that is constructed from our common taxes, and to use part of that money not to buy this final solutions, that are already on the market, but mostly to find ways of finding and beginning with problems and with needs, and to work together using that money to the hospitals and other providers, public providers, to work with startups or the different collaboration consortia to develop solutions that are not on the market. Also, that this interest is mostly also related, or is also related with the gap that Europe has with the United States on relation to innovation. So mostly innovation procurement and public innovation procurement mostly is the utilization of public funding that is given to healthcare providers, and mostly to use it to promote innovative products and solutions. In this sense, we can split two different concepts. One is pre-commercial procurement, PCPs, and another one is public procurement of innovative solutions, PPEs. I will give you an example of a PCP that we are working on, and another example on the PPI that we are also working on. But mostly these two grades, these two concepts are related with the TRL of the specific development of the products. Let me show you one of the projects that we are working on that is a PPI that we wanted mostly, that is a Procura project, that we mostly wanted to use it as a way. And actually, we started by a problem that we had, that is the integration of services between inpatients and outpatients, mostly with the elderly. So we have this problem when we discharge a patient. Actually, there is a fragmentation, a gap, when we connect to the patient of the home, but also with other community providers. So mostly we ask the market with a group of other providers, in this case from Spain and France. What we wanted is we develop a consortium where we wanted to develop products that would help us to have a better connection between the inpatient discharge and the provision of social services. So mostly we asked the market to develop two specific solutions. One was a walker with specific characteristics that I'm going to show you, and another one was a supportive tool for using toilets that is quite relevant for the elderly. But I'm going to show you the example of a product that is still on development. And actually, we start with the idea about this the PPE is that as a procurer, we ask the market to develop the solution, but we also help the entity that is developing the product. We help them developing, we test it, and I'm going to show you what is the stage that we are at this point with this specific walker. That again is not finished, but we are on the phases of testing it. So mostly the idea, as I told you, was to develop a specific walker that could help the elderly to have this idea where they start rehabilitation as inpatient, but also to continue to have this possibility in a social provider or at home. And so we defined specific characteristics for this walker, and we selected a company to help us on developing it. And actually we see, for example, one of the features that we wanted was, of course, to be friendly to the age population that will use this, but also to have specific characteristics. For example, a way of stopping it. As you can see, it can be a problem, for example, for the elderly with a common walker. This one, for example, it stops immediately when it rolls off. The other one was to have the possibility also to control the walker and to ask the walker to come using the phone and to get the walker near the patient to help him. Another one is to have the ability of calling the walker by using only voice commands. As you can see, so mostly our idea, and actually, as I told you, this is on the stage of testing, and we are still testing it. And yet the principle about the PPE is to test it with the supplier. Let me just going to show you the ROSIA project that is pre-commercial procurement. And mostly on the ROSIA, what we want is to develop a remote rehabilitation services for isolated areas. Mostly this is an European project funded by Horizon 2020, and is this being executed for the period of 54 months, and it is coordinated by the Institute of Social Services in Aragon community in Spain. But mostly it starts, of course, with a problem where we are not able to promote rehabilitation services in remote areas. And what we wanted is also to ask the market to develop a solution that could help us on this, mostly on providing these rehabilitation services at the patient environment. That should be flexible solutions and scalable solutions based, of course, in value-based care. Also, it should be tailored integrated care model. So in connection with the hospital, social providers and primary care, and of course, be something that can be motivating. So we focus initially in 7 pathologies, that is chronic spinal cord injury, acquired brain injury, pneumology, mostly pneumonia, arthroplasty, cardiovascular diseases, hip fracture, and COVID-19. This is a project with 5 partners from 5 countries. Actually, we have health service providers as hospitals, as we have here in Coimbra, but also with the rehabilitation institutes in Dublin, and also colleagues in Spain. And we have also testing facilities, for example, in Portugal, with 2 municipalities that are helping us, that is Municipality of Sor and Penela. So at this point, we are launching the open market consultation that I'm going to give you the date at the end of this presentation. And mostly what we are on the process of telling the market that we are going to launch this PCP that will roll out in 3 stages. So the first stage is the solution of design, and we launch a tender for 100,000 euros for 5 potential bidders, and we ask for these bidders to present solutions, in this case design the solution, and then from those 5 potential bidders we are going to select 3 cases where we are going to help to develop a prototype. This is the phase 2, and for developing the prototype, in this case, we have 900,000 euros. And on phase 3, we are going to validate 2 potential prototypes from the previous phase. And for this, we have nearly 3 million euros to develop this prototype solution and testing them on real life scenarios. As I told you, we are now on phase 0, where we are analyzing the state of the art, co-designing with different stakeholders, identifying user needs according to the conditions that I mentioned previously, and we are now on the phase of launching the open market consultation. Let me just give you an initial use case for a person living with a cardiovascular condition. This is case of Francisco, 60 years old man, living in a small municipality in Spain. He's a farmer, married, 2 sons, lives with his wife, 59 years old, ex-smoker. He has hypertension and he had an heart attack, and he lives far from the hospital. And actually, if we see his narrative, mostly he would be hospitalized for a few days. You would need to have a supervised rehabilitation program in a cardiac rehabilitation unit. And then on phase 3, you would have his maintenance, mostly with unsupervised physical activities, and he would be followed in primary care center. What we want with Rosia, it's completely is to change this clinical pathway, mostly focus on phase 1, actually on preparing the discharge, more online training, introduction to a rehab journey. So using and working with a patient, giving them more autonomy and literacy on managing this condition. On phase 2, we start the early rehabilitation as an outpatient, but also we work on training in the digital rehabilitation, and we would prescribe different apps from Rosia catalog that we want to have available. And then at home, you would have a personalized digital rehabilitation program with different and specific characteristics. So mostly this is the idea behind Rosia. We are going to get also an open market consultation in the 25th. It is international, and you can visit the website, Rosia website. We will have also another one in Ireland in the 28th of June, and the Portuguese open market information event, which will be on the 30th June, and the open market will be launched on the 12th of July. So please engage on this pre-open market events that I mentioned. Again, the dates, the Portuguese one is on the 30th of June. Let me also just to present my team and the team of Coimbra University Hospital and our innovation managers, that is Patrícia Coceiro and her contact, and Inês Ferreira, that is also working as an innovation manager here at Coimbra University Hospital. Let me say that we have more at this point, we have raised more than 4.5 million euros on innovation projects. We are managing more than 25 innovation projects at this moment, and we want to engage with different partners from startups, from different consortia, also to test technology. And we are also partner of JoinHealth, and this is a big community where we start and we want to engage startups and to be a good partner to startups and other consortiums to develop innovation solutions. So thank you so much for your time, and I'm open to questions. Thank you.
Thank you very much, Dr. Alexandre Lourenço. So not sure we have questions from the audience yet, but I have 1 or 2 questions that I would like to more on a kind of challenges and brainstorming that I would like to ask you. You mentioned this funding opportunities from Horizon 2020, and as you know, there are a lot of funding opportunities also in the Horizon Europe to come. But the impression that we get is that there is still a little engagement of the Portuguese institutions in this kind of funding opportunities for public procurement. What do you think that actually the Portuguese institutions are taking the advantage of the opportunities for innovation procurement, or do you have a different perspective? And as someone that has been very much engaged in these, what is your view? What do you think are the main reasons for this lack of engagement?
Thank you, Patricia, for the question. Actually, I'm trying to promote innovation procurement since 2018, also as a partner of the European Commission at European level, and it has been a struggle, I must say. This is a strategy that was developed mostly for public institutions, and it is a struggle, mostly because, and actually, I think it's quite parallel with innovation management in public institutions. Yeah, and it's not a particularity of the healthcare sector. It's quite broader. Actually, I must say that probably the health sector under public organizations are the ones that are more evolved, even in Portugal, when we compare with others. And even, just a parenthesis, our innovation agency realized this, and mostly is also trying to promote services to support public entities to engage on innovation procurement, mostly to try to deal with the issues about that are quite challenging, that are the legal issues related to it. And so ANI is supporting now, public is creating this center to support public entities. But just, Miguel, back to your question. Actually, this requires a cultural shift in public entities. From my side, in hospitals, we are mostly focused on on purchase specific solutions according to the things that we have already some degree of confidence. And this is not only related with products, but also the way that we are organized. We resist a lot to change. To ask healthcare professionals to think differently, it's quite demanding. And what we try to develop is strategies that we can promote open innovation management, mostly to train healthcare professionals to think on the problems. And from our side, as Patricia and Inez that I present you, is mostly to identify those and help healthcare professionals to identify those challenges, and mostly to go to the market saying, we have this problem, can you help us? We have specific, now we have specific areas where we are working on, for example, on ENT, ear and nose and throats, where we are working on specific areas, and when we engage with different partners to try to help us developing solutions. Even, I must say, that in some cases, we have some intellectual property from our side, and actually, if professionals are able to do it, and if they want it, our healthcare professionals, actually, in a specific case, they release all their intellectual property to the private providers for them to allow them to develop a product that can enter the market. And we are going to test it and helping the private provider to developing it. So this way of thinking and this shift, this cultural shift from final solutions to think on the problems, identify the problems, and ask the community to help us solving it, that's the most difficult.
Yeah, I think there is still some awareness that needs to be created, and I think as you mentioned, our National Agency for Innovation is doing a great job on that, on creating this competences center. And on this, and it's another question now from the audience, from a different perspective, but it has to do with this topic, is how can startups innovate or have access to do pilots in public health sector, since there are so many restraints with the public hospital? So I think some of this has been already mentioned, but if you want to comment on this.
I don't know if there are specific restrictions from public hospitals. I know that the health system is quite difficult to work with. Mostly most healthcare professionals are focused on providing care, and we need to arrange time and to find time for them to use these solutions. I must say that even the private sector, in my opinion, is much more difficult to introduce innovation, probably in the way that it should be introduced, that is allowing us to develop more people-centered care. And in that sense, the private providers, directly private providers, there isn't a market for innovation in that area. For example, in these disruptive innovations that I showed you, for example, as Rosia or the Procurement project or other projects that we have, like, for example, we are testing now devices for implantable brain devices for epilepsy, or, for example, different devices for infusion of oncological drugs. It's much easier to implement it on public hospitals than on private hospitals, where they are much more focused on invoicing the payers than in public hospitals. We have more space, we have more connections with universities and academia. Most of our professionals are also, for example, in Coimbra University Hospital, more than 50% of our doctors are also researchers and university professors. It's much easier to implement it here than in other areas, and even our ecosystem is much more friendly, as I showed you, with the social providers, with primary care, with municipalities, and we have this big ecosystem that is much easier to introduce technologies that really change the way that we provide services. And again, even our innovation budget nowadays, it's 4.5 million euros, and our budget in our hospital is 500 million a year, and it's below 5% of the overall operational budget in our organization. I believe that we are, and hopefully we are going to increase the budget of innovation in our hospital. Even if you compare this, and I believe that is quite short, the amount that we have for innovation, if you compare with the private providers, at least in Portugal, we have further growth and further investment in innovation than other providers.
Thank you. So to finish, I would ask you also another final question. So how important is this co-creation process to meet those needs that you mentioned, that and also to make the health professionals also comfortable and to meet those trust and recognition problems that you also mentioned that are typical from the healthcare?
Well, there are two ways of testing or introducing technology. One, as I told you, is an open innovation strategy, where we ask healthcare professionals, we ask patients what are the problems, and then we identify or prioritize the problems, and we go to the market asking the market to help us developing. In our case, we have a strategy with the IPN, Instituto Pedro Nunes, where it is our main partner on identifying those solutions. And as I told you, we have several projects developing this way. And then we try to find investment for the developing these solutions or not, if it is needed or not. But mostly we engage immediately in co-creative process with healthcare professionals and patients. The other one is mostly when a startup engages with us and wants to test a specific product, what we try to do. And for example, we have a strategy with Biocant, or also with the companies that are incubated at IPN, or other projects that, for example, come from the EAT Health network. And as I told you, we have, at this point, I believe that we have 5 or 6 innovation projects from EAT Health and from different startups and academia initiatives that we develop projects together. What we try to do is identify the healthcare professionals or where we can test those products and solutions within the organization. And of course, healthcare professionals and patients play a very important role on testing the technology.
Thank you very much. I think there are no more questions from the audience. So I would like to finish this webinar by thanking again the speakers, Dr. Alexandre Lourenço. It was a pleasure to have you here. We had a very interesting discussion, so thank you very much. And there are a lot of important points that were raised, and I think these are important contacts also for the companies and then the researchers that are watching these webinars to know which points of contact that they should reach when they want to test their innovation. So again, thank you for the attendees for being here today. And I will just share my screen so you can have access to the QR code that will lead you to the series of webinars, and where you can see online the program for the next webinars.